सॉरी मु बैकग्राउंड हटे देली भल लागुची बैकग्राउंड हटे देली इज दैट ओके वॉइस ठीक अछि
हां भाई वॉइस ठीक अछि ए बैकग्राउंड भलो अछि नेचुरल बैकग्राउंड
ओके डॉक्टर मित्तली नमस्कार
सॉरी नमस्कार
नमस्कार और हमारे सब स्पीकर आसी हां वेरी गुड
दीपक सर नमस्कार
नमस्ते मुमताज जी नमस्ते एवरीवन आवाज क्लियर है ऑल ओके बैकग्राउंड में ऐसी कोई खास नॉइज नहीं है गुड
डॉक्टर मित्तली नमस्कार
नमस्कार सॉरी नमस्कार
और हमारे सब स्पीकर आसी
अच्छा ये अमित
हां अजित भाई
मु ए जो व्हाट्स ए जो एबे हम चार्ट रे हम चार्ट रे पठेली जो YouTube रो
लिंक ता
बैकग्राउंड में ऐसी कोई खास नॉइज नहीं है गुड
हैला YouTube रो एटा को पठेली तमे सेटा को टेके हमरो ओरियोस फेसबुक रे पके देबो अच्छा ये
ठीक अछि
अमित
हां अजित भाई
मु ए जो चार्ट रे पठेली जो YouTube रो लिंक हैला YouTube रो एटा को पठेली तमे सेटा को टेके हमरो ओरियोस फेसबुक रे पके देबो
ठीक अछि
अमित हां अजित मु ए जो चार्ट रे पठेली जो YouTube रो लिंक हैला YouTube रो एटा को पठेली तमे सेटा को टेके हमरो ओरियोस फेसबुक रे पके देबो हां राम
ठीक अछि
अमित हां अजित मु ए जो हां चार्ट रे पठेली जो कना मो सिस्टम रे चले छी YouTube पे चल छी बता तमे सेटा को टेके
संबित वेट करछि टिके के अलाउ कर आई थिंक वी डिड अ मिस्टेक people are waiting
I think the timing was different data jagare nalini one said 6:30 and one said 7
नहीं सेटा कोन हेछि जूम रे हमें जल्दी जॉइन करिवल 6:30 रे जो प्रोग्राम टा स्टार्ट माने हेछि 6:30 करछु सो दैट वी जॉइन अर्ली बट फ्लायर सबुतरे 7 to 8 लिखा हेछि सो आई थिंक देयर स्टिल देयर वाज बिट ऑफ अ कंफ्यूजन
ओडे कंप्यूटर ओडे कोटा
सो अमित तमे यूट्यूब सो भाई नलिनी भाई से जो यूट्यूब रो जो यूआरएल टा लाइव अछि सेटा केमती कोन जहा को पठेबा जो माने आउटसाइड ओरियोस ओडिसा रो के जॉइन करबो ताले सेटा
सर्कल हबो
हां सेटा से खाली यूआरएल टा पठे देले से देख परिबे
ओके हम पठे देछ सर्कल
मु जो मेसेज रे पठे देछि यूट्यूब रो
हम मु सेटा ही फेसबुक रे ये करछ हमरो पेज टारे भी मु सेटा पब्लिश करछि जस्ट
ओके और जो सत्य जॉइन करिवो सेटा माने अजित तमे न्यू साउथ वेल्स रे शेयर कर दियो सत्य दियो कर दो सत्य जॉइन करने मते
I will start in 5 minutes ना wait करिवा टिके
अब 5 मिनट पर देखियो 3-4 मिनट 5 मिनट वेट करो जो शेयर करा था कर दीजिए बाहर फाइन अच्छा अच्छा अजित नहीं नामको माने सेटा को चेंज करिया जो माने अलाउ कलर अलाउ करिया पडुची दरकार पडुची बट कैन बी मेक इट आ हबनी बदे से क्रिएट कला को जायतिला दस ओके वी कैन
अजित आसिला अजित को पचारिले हबो अजित सेटा को जो अलाउ करिया को सेटा को सेटा रखिले एबे चेंज करी हबो टू लाइक सेटा को एडमिट ऑल मानसे रेस्ट्रिक्शन टाइ दरकार नै हमरो
हां मु देखु सेटा मु सेटा हटे देली एबे समस्त बदे डायरेक्ट जॉइन कर परिबे
ओके बेटर Ram mute all option आसुची
म्यूट ऑल ऑप्शन अच्छी अपा
मते के आसुनी हमारी तो होस्ट
the participants list रे आछी at the bottom.
मते आसुनी
Okay.
Hello everyone.
Hi bhai.
हेलो भाई नमस्कार
So namaskar. Should we go mute because we'll be listening to you guys?
नमस्कार
भाई स्टार्ट है नहीं कॉपी करिवे अब
आपण कथा करी सतरा हला बट एनीवे
हां एबे आसिला राम
Okay.
राजेंद्र भाई ना कौन सा लेंबू पानी ना आउ की पानी पिउचंदी
I'll leave it to your imagination, my dear.
इमेजिनेशन तो बहुत किछ हो जाउची
Just yes.
by the way this is like
Live.
health seminar so
We are live.
So what? Oh no. Can you please elaborate? Is it a health seminar? So what?
ना किछ नहीं all good lembu pani भी भलो any pani भी भलो pani is good for us
No.
Hydration is important.
yes
very important
Do you have also a dress code to participate in this?
ना why ना so just मजा
No, I know that.
अच्छा मो कथा रेडी डेरी होची की ना सुबुची
No, it's fantastic. Very good quality.
okay good Allah
Today, actually, I was at a meeting here. It was hosted by FICQ, Federation of Indian Communities, and also Penny Wong was here, basically talking about all this, the latest fiasco by the current government about the restrictions and all that. Yeah, so that was very interesting. Is there any sort of like noise happening in Canberra on that?
yeah माने बहुत होची माने गुडा जोडा मल्टी डिसिप्लिनरी सब माने गुडा कमिटी सब करूछंती नॉइज करूछंती बट अल्टीमेटली कोन होबो जणा नै बट आई थिंक चलची गुडा मूव सो मल्टीकल्चरल डिफरेंट ऑर्गेनाइजेशन सब माने करूछंती
Because the way they are saying only 200 people just to one plane load 200 people, it will take a long time to actually get a lot of people back.
नहीं आई थिंक ता सहित माने डिफरेंट लेवल रे जोडा माने कॉलेज जोडा गुडा एकठी करूछंती जोडा माने मेडिकल कॉलेज जोडा माने रॉयल कॉलेज they are making a lot of noise and things will change apparently माने सब किछि ओटे एंटी मैसेज आसी कि things will change बहुत पैसे पड़छ से लेवल रे नमस्कार
काहाको नमस्कार कहले
आपण कर सारे
नहीं कने काहाको नमस्कार कहले
विघ्न
बाबू ओके
नमस्कार पढ़ी हो
नमस्कार विघ्न बाबू माने कोन दुनिया से एते छोट होई गला आपण कोडे हमें याडे
नहीं अब दिल से दिल अच्छी बेसी दूर रे दूर 2-3,000 किलोमीटर दिल से तो दिल मिलुची त
संबित कोन गोटे फोटो रे सदा
नमस्कार हैप्पी 25th एनिवर्सरी आपको
काको
हैं नहीं आबर 4 वर्ष तळु सरलाडी आबे बुढा ही लोडी ऑलरेडी आबर 2017 थिला
Okay, so we should wait for your 50 years then.
Exactly. सेठे जल्दी
अच्छा सुनो तो मु देखली जो हमरो YouTube टा लाइव होउची परफेक्ट आसुची ओनली 10 सेकंड्स रो गैप रहउची तो जदी मु सेई चार्ट विंडो रे पकी देइची जो YouTube टा जदी आपण केई पठेबे आपण ओडिसा को तले इट्स ए लाइव नाउ सो खाली 10 मिनिट्स टिके लाग रहउची 10 सेकंड्स लाग रहउची नले इट्स गोइंग परफेक्ट
Yeah, I can see it as well.
Okay, bhai, at what time are we starting?
I think another 2 minutes will start.
Okay. So in 2 minutes, Mamtaz de khali apananku mu focus mane ye unmute rahibo, baki samaste mute re rahibo. Okay.
Okay, going mute.
2 minutes supre kahi basiba gopiba.
Good evening, everyone.
Namaste.
Namaste. केमती अछंती समस्ते?
बढ़िया बढ़िया एटा तो माने गोटे अपॉर्चुनिटी मिलची समस्त कनेक्ट हेबा पई.
Absolutely, good idea. Expecting a lot of participants na nahi?
Nah, actually I was expecting quite a lot. We'll see.
Acha.
Can I share my experience of last night? I went to bed at 2 o'clock because I was with my friends back in Sambalpur to admit one of my closest friend to Vikas Hospital in an ICU with an ICU bed. It is so difficult. It is so difficult. My friend, who is a superintendent engineer, managed to use his contact with the collector and local MP and everything, and managed to get one bed. Actually, before one bed is vacated, there are like 20 people queuing up. It's really very, very scary situation there. Our जो district headquarter hospital मानक खोला जाइए कोविड सेंटर ताको कॉन्ट्रैक्ट दिया जाइए केते गुडक अछंती जो हेल्थ जो कोन सारा कहंती ग्रुप्स सेठिरे पसिले जणे तांकर केही केही जानि पाउ नाहंती से भितर कोन होउची से कोन करछंती कोन केमिति अछि. So at least in Vikas, that sort of hospital, you're able to actually call their, like the number achi, and they update you. But really yesterday, first and our experience, how difficult it is to find a bed now, and with the ICU and ventilators and all that. It is amazing.
Bhai, we had similar experience. And at that time, situation was not so bad as it is now. So I can only imagine.
बहुत लोग मते कहले बहुत लोग एडवाइस कले गो टू भुवनेश्वर गो टू भुवनेश्वर गो टू भुवनेश्वर.
Not a good idea.
आगुटे सांग भी तार भी देह खराब गो टू भुवनेश्वर. But thing is that भुवनेश्वर कोन बेड अछि
नहीं कहउछ मत बहुत सारे बेड अछि बोली माने अवेलेबल होउछ
नहीं
ओके
नहीं भाई सबबडी सेम सिचुएशन
काली आपर काली पाडियो कोले काली आपर राति 12टा पद काली मो निज सळा ता कोविड हिची तार ऑक्सीजन माने काफी फ्लक्चुएट कला बोली पर रात्रि भी नळिन सहित कथा ताइतिली एबिति रिपोर्ट तार सीटी स्कैन रिपोर्ट बढ़िया अछि माने नॉर्मल वाला लागुची कि तार ऑक्सीजन फ्लक्चुएट करतला बोली काली हमें दिन सारा चेष्टा करी फाइनली से रांची रे अछि रांची छोटा मेडिकल साइंस रे हमें से कहला सीट अछि नहीं कास आमे जीवा पूर्व देखिलु तार माने ऑक्सीजन लेवल 75 80 रे रहउतला सेठी जाके पहुंचला पाछे टेस्ट कला 97 बाहरला सर कहला हम एडमिट करिवनी तम 97 अछि आबर बिलो 92 रहले कि हम एडिशन करिवु त फेरे देले राति 12 तो फेरे देले आमे राति
yeah sorry to interrupt but I think we should start.
Okay start
to Mamtaz so yes
thank you bhai yeah Ram mute all namaste to all of you. First of all, I like to thank all of you who has found some time out of their busy schedule to join us with this webinar on physical and mental health. A warm welcome to you all on behalf of Orios INC, which is like Orios in Australia. As you all know, COVID-19 has affected our daily life in unprecedented ways, and that's what we were discussing a little bit earlier. There has been job losses in business, work from home, deaths, and whatnot, which has caused a large disruption to our physical activity, our sleep timings, and which is eventually affecting our mental health. We're not realizing that. We are just going with the flow. We are not realizing the consequences. Today, we have here with us our health experts to guide us on how to cope with the situation and maintain our physical and mental well-being. With that, I would like to welcome our Orios INC President, Dr. Nalini Pati, to say a few words before we formally start the webinar. Nalini bhai, over to you.
Namaskar. Thanks, Mamtaz. Thank you. Namaskar. Namaste. Namaskar. Samastanku. Before I begin, I just would like to acknowledge the traditional custodians of the land on which we gathered today and pay my respect to their elders, past and present. I extend that respect to Aboriginal and Torres Strait Islander people here today. So it is a very difficult situation what we are going through, particularly with our friends and families. I mean, being in the medical profession, I get pretty much like same thing. Other people, Dr. Mitali also will and agree with me, and Prabhati also same thing. Like we get a lot of phone calls, a lot of things, like pretty much every day, 1 or 2 phone calls, frantic phone calls sometimes, early morning calls as to what to do. Patient is going through hypoxia, the oxygen levels are dropping, and what we should do. The situation is pretty bad, and also the mental difficulties they are going through is quite enormous. So thank you all for joining for this webinar. I think again, it's a Saturday evening, you would be otherwise doing something else. Thank you for giving this time. And then I think we should spread the word, and we all need to stay strong and support our families with the different things. Again, physically we are not there with them, but I think we can do a lot of things staying at this distance. So I think we all are doing it. I think we can do even a little bit more, whatever we can, and join hands. And if anything, any new ideas, please share with us and see as an organization what we can do. We are trying to start the fundraising soon within next 24 hours. We had a lot of ideas as to who to support and all that. We will start and see what we can do for our motherland. So without taking much of time, thank you again. And we have got experts, and I will leave Mamtaz to lead through the program. Thank you again, and we'll see what the questions come up at the end. Thank you.
Thank you, Bhai. Before we start, I'll just request all to keep muted unless you are speaking. And if you have any questions, please use the chat box. Dr. Ram has happily volunteered to keep track of the questions, and we'll take up the questions at the end of the webinar. And I request all the speakers to please stick to the allotted time of 20 minutes so that we can finish on time. Thank you. With that, let's start. Our first speaker is Dr. Mitali Das, who is going to take us through the ABC of mental health. She is graduated from SCB Medical College and has been in Australia since 2000. She also holds a master's degree in psychology from Monash University and has done her fellowship in psychiatry. She is currently working in Monash Medical Center and also runs a private practice at Epworth and Delmont Hospital, Melbourne. Dr. Mitali Das, over to you. By the way, I was also a student of SCB Medical Public School, not the college.
Thank you, Mamtaz. Namaskar, everyone, and thank you all for joining on a Saturday evening. I guess we are all going through some unprecedented and difficult times over the last 15 months due to what we call this pandemic. Pandemic is a word we probably hadn't heard for a long, long period of time. And this seems to have made our world, which was such a small place due to internet, has now become a vast place where we are unable to reach our families and friends and relatives when we need to. And this has been a source of fear, anxiety, agony, and for a multitude of other reasons as well. As Mamtaz said, we are not able to reach our families, we cannot speak with them, cannot help them in their time of need. We have been working from home, children have been managing school from home. There's always a fear of job loss, and all this is playing a great impact on our mental health. In order to help ourselves stay calm, we will go through a few tips today, which all of you will probably know, and this will probably be a refresher for you. But it's important to do that, because unless we are calm and collected, we will not be able to help anyone, be it our family or friends. So with that, we'll start today on the very basics of mental health, ABC of mental health. I'm now trying to share my screen with you. Can I do that? It says,
yeah, we need to make a host. Is it, Ram?
Yeah, host disabled participant screen, it says. Can someone allow?
Yes, now you can do, I think. Yeah. Thanks, Ram.
You can share the screen now.
We start off with what actually is mental health. Mental health is not merely the absence of mental illness. It includes very many dimensions, and these include physical, intellectual, environmental, vocational, social, emotional, and spiritual health. All these make us how we function here on a day-to-day basis is important for our mental well-being. And unless we have that, we are not able to fulfill these requirements. According to WHO, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with normal stresses of life, can work productively, and is able to make some contribution to his or her own community. The factors that are considered to be key elements of psychological well-being include self-acceptance, personal growth, a purpose in life, environmental mastery, to be able to choose or change your circumstances and your environment using your own thoughts and decision making. Autonomy or independence of your own thoughts and action. A positive relationship with others. And when do you think that your mental health is not at its best? There are 5 warning signs to watch for, especially when you have a couple or more of these symptoms. If you experience long-lasting sadness or feeling irritable when there is no triggers or no factors that should be causing this. If your moods are extremely high and low, up and down, what we say. Excessive fear or worry or anxiety. Now, worries and anxieties are a part of our daily lives, but when it becomes in excess, then we are not able to complete our day-to-day function well, and that is when it is an important thing to consider. Dramatic changes in eating or sleeping habits. Sometimes you will note that if someone is anxious or stressed, they either stop eating, they don't have any appetite, or they tend to overeat or binge eat. Similarly with sleep, some will not sleep, they will be feeling tired all day, but they will be unable to fall asleep. But some will sleep excessively, even during the day. Sorry. Are you experiencing this, some problem with the screen? So warning sign.
All good.
Okay. What is poor mental health? Simply put, this is when our mental health is not what we think and feel it should be. Finding it difficult to manage how we think, feel, or act with respect to daily stresses could be a sign of poor mental health. A person with poor mental health may experience different emotions, including anxiety, anger, shame, sadness. One may expect also to feel helpless in regard to the situation. Now, this is just a brief overview of the types of mental illnesses which we as psychiatrists come across every day. But this is not what we are going to focus on today. Anxiety disorders, behavioral and emotional disturbances in children, bipolar affective disorder, depression, dissociation and dissociative disorders, obsessive compulsive disorders, eating disorders, paranoia, post-traumatic stress disorders, psychosis, and schizophrenia. But as I said, these are the type of illnesses that we deal with on a day-to-day basis. But today we are not talking about mental illness, rather mental health and well-being. So what are the 6 factors that can be considered as key elements to psychological well-being? Self-acceptance, personal growth and development, having a purpose in life, environmental mastery, autonomy, and positive relationships with others, as I had mentioned before. The steps to mental well-being. It's important to practice this on a day-to-day basis to keep well and be self-sufficient. Connect with other people, be physically active, learn new skills each day, give and share with others, mindfulness. And I cannot stress the importance of each one of these on a day-to-day basis. How do you look after your own mental health? This is very important because if you have been on a flight, you know how the air hostess will say that if the oxygen drops down, you have to put it on first before you try to help your neighbor or your family sitting next to you. Similarly, if your mental health is not at its premium, then you will not be in a position to help anyone, including family, friends, or relatives. The way to do this is to talk about your feelings. It is important to share the stress or anxiety or worries that you are feeling when you're troubled. And you could do that with your partner, with your family, with friends, relatives. And if that is an issue, or beyond that, you are not able to manage that, your GP is the next line to contact, and they can guide you through that. And if the GP feels that you are in need of a psychologist, they will refer you for a psychology sessions. The other thing to do is to keep active. Physical health and activity is very important for your mental health, and vice versa. It becomes a vicious cycle. If one is affected, then the other definitely gets affected. Eat well. As I said, sometimes when people are stressed, they either eat excessively or stop eating well at all. Similarly, drink sensibly. Sometimes you will have noted that people, when they are stressed, think that a drink can be helpful. Simply because alcohol at that point of time gives a sense of gratification. But drinking sensibly is important because alcohol, either in the long run or in excess, is a depressant and can cause depression and anxiety. Something that we tend to forget every day. Keep in touch. Keep in touch with family, friends, relatives, and your social circle. Ask for help. If you're not coping, it is always good to seek out that help. And that is not meant to be anything demeaning on your part. It is rather a matter of strength that you're able to recognize your problem and are seeking help for it. Take a break from anything that is causing the stress. If you're able to take some time off work and engage yourself in something else, if work is what has been stressful, do something that you are good at. Whether it's a hobby or something you enjoy, it's important that you focus on those things. Now, what is bad for mental health? Most of us know all this, but it's good to remember that bad sleeping habits are really bad for mental health. So, drinking coffee late in the day will be effective in keeping you up to late night, maybe to finish a project that you're supposed to do next day, but it won't be effective in getting you to fall asleep. And that will leave you tired the next day and not fulfilling your workload to the best of your ability. Engaging in stressful situations before bedtime, that also activates the brain and you find it difficult to fall asleep, which is why we say, watching horror movies or, violent movies at the end of the day is not a good thing. And these days, Netflix is full of all those sort of shows, but we would advise not to see at the end of the day. Using electronic devices before bedtime. Now we all know this, and in fact, we always advise the children not to do this, but all of us are in some way or the other doing this when just before bedtime. We're checking emails on our telephone or sitting on our laptop trying to watch something. The light from these electronic devices, the blue light, as we say, is very stimulating for the brain. So you will have trouble falling asleep. And then that becomes a vicious cycle for your mental health. When it comes to mental health, these habits and patterns of thinking can be your worst enemy, actually. We've been talking about stress and worries. So what is anxiety? Anxiety is more than just feeling stressed and worried. While stress and anxious feelings are a common part of our everyday life, to situations when we feel under pressure, they usually pass when the stressful situation has passed or the stressor is over. Anxiety is the most common mental health condition in Australia and worldwide. On an average, 1 in 4 people suffer from anxiety. 1 in 3 women and 1 in 5 men will experience anxiety at some stage of their life. If you do a survey of people walking on the streets, I think this will be the status that you will find. In a 12-month period, over 2 million Australians experience anxiety. There are many ways to help anxiety, and sooner people with anxiety get support, the more likely they will be to recover. What are the symptoms of stress that you may experience? Some people do not even notice that they are stressed until the symptoms occur. And these symptoms could be feeling moody or anxious or irritable when there is no trigger, experience back and neck pain, frequent headaches, which can be minor or severe migraines, tummy upset, feeling upset, queasy feeling in the stomach, increase in your blood pressure, changes in your appetite. Some people experience rashes, skin breakouts, chest pain. Some people have an existing physical problems become worse. And people become susceptible to minor illnesses such as cold and flu and take time to recover from these. How do you manage anxiety? Identify your stressors and see if there are some things you can do to control and manage these better. Sometimes some things will be beyond your control. For example, if you work on a job that gives you deadlines for every day, then you can't help that. You can't change that without changing your job. But perhaps you can find some way to control these aspects, such as scheduling what you have to do, taking short breaks in between as a refresher, or going to bed early so that you can wake up early and fresh to complete the job, because that's the time when you have more energy and your brain functions better. Build regular exercise to your life. A balanced lifestyle gives you more energy. Many people find that going to the gym after work or playing a sport helps them to unwind. It might be initially difficult when you come back home to think of changing your gear and going to a gym. But if you give yourself that little bit of push and go to the gym, you'll find that you do feel much better. And at this point, I cannot stress enough about the importance of yoga in stress management. We will be talking about yoga in the next session, I guess. So I won't go into more details about that. Make sure that you eat and sleep well. We've discussed this a little bit earlier. So it's important. Healthy diet and sleep are very important for your mental health and peace. Take time out for the family, friends, and recreational activities. Now, most of us know that this is important, but we do not always do it. If you find it hard to make time, then perhaps take some deliberate steps. Structure your day, structure your week so that you can find time to set aside for social evenings where you meet up with friends and enjoy a hobby, or set aside one day to just relax at home and chill and not do anything. Problem-solving techniques. Brainstorming solutions and then choosing to put one of those into action after listing the pros and cons of each option is an important thing. We generally tend to get into things without thinking of and planning, and that makes it even more difficult for us to problem solve. Calming techniques. Now, this is what we call cognitive behavior therapy, controlled breathing, and progressive muscle relaxation. What this does is trains your body and mind to become more relaxed. The importance of breathing is a part of yoga. What actually happens is that when you breathe in slowly and deeply, your lungs fills up with more oxygen than when you are anxious and breathing shallow. As your lungs fills up with more oxygen, what it does is it takes the time to supply that oxygen to the rest of your body, particularly the brain. When you're anxious and you're breathing shallow, your brain and the rest of your body is not getting enough oxygen. And so in anxiety, you get this fuzzy feeling in the brain where you can't think straight. You get tingling sensation in your muscles and your fingertips and queasy feeling in the tummy because your body is not circulating enough oxygen to your muscles. So it is very important to learn this technique and practice this even when you're not feeling anxious, so that when you are feeling anxious and stressed, you automatically revert to your controlled breathing techniques. Share your thoughts. We've talked about how important it is to socialize, have your family and friends and your support network. You may have that one go-to friend who you can discuss your heart out with, talk about your stresses, and that person with whom you will not feel judged. That friend could be your partner, could be your father, your son, your mother, someone who can listen to you and offer some advice. And even if they are not able to offer the advice that will be helpful to you, at least they have given you a listening ear. And that talking eases out the anxiety to a great extent and reduces your stress. If you're unable to find any of this, as I suggested earlier, your GP is the best person to go to. And last, but definitely not the least, consider whether you are thinking negative. And is this causing you to be more stressed? Negative thinking can make us worry about everything more than necessary, increasing the stress. And generally, it does not motivate us to take any positive actions. We are almost losing the battle before we have started on it, if you think negative. So breathing techniques, yoga, mindfulness, having a good routine and exercise are the keys to your mental health and well-being. There's so much more that can be said on this topic, but I think I might be running out of time if I stress on this. So thank you all for listening. And if there are any questions, I'm happy to take them at the end of the session, I think.
Yes, Nani. Thanks a lot, Mitali Nani. As you said in the beginning, we all know it, but it's always good to remind ourselves of all these things or refresh our memory of all these things so that we can utilize it in our day-to-day life. And that will be really good for all of us. Thanks, Nani. Now I would like to welcome Dr. Deepak Sachdeva. Mobility is the litmus test of your health in your old age. And yes, that's the motto of Dr. Sachdeva, to help people to stay fit for 100 years. Dr. Sachdeva is a renowned medical yoga expert and one of the most sought after speakers on health-related seminars. And he had given live seminars and health talks all around the world. It was a big list, so I thought I'll just stick to all around the world. He's also a lifestyle expert with a modern and practical outlook. Practical is the thing that we all need. He believes that we should all be mobile till our last day, which is so true also. His talks are designed around what mistakes we generally do that adversely affects our mobility in later life. So let's over to Dr. Deepak to start the session.
Namaste, everyone. Thank you, Mumtaz, for this wonderful introduction. So, before we start with the topic that how to stay fit in your busy life, I want you to tell me, what do you understand with the word yoga? What is yoga as per you? Is it just asanas? Is it breathing? Is it some form of exercise? Or is it something spiritual, something religious, something that only yogis can do? You have to go to Himalayas to do that? Or what do you understand with yoga? You can type your answers in the chat box, or you can simply unmute yourself and tell me what is your understanding of yoga. Just before me, Dr. Mitali mentioned that in cognitive behavior, breathing techniques are required. For improving mental health, your exercise is required. For something, deep guided relaxation techniques, progressive muscle relaxation techniques are required. All these things are a part of yoga practice, regular yoga practice. So what actually yoga is all about? What do you mean when I ask you what's yoga? So yoga is to live a balanced life, a balanced life. So ati yoga, heen yoga, mithya yoga are all wrong. Ati yoga means overuse, misuse and less use is not allowed. What we talk is sama yoga, means balanced use of your body, mind and spirit. The moment you go out of balance, that is when the problem starts. That is when the problem sets into your body. And there are only three ways any problem can set into your body: ahar, vihar and vichar. So your diet, your activities and your thoughts. You make a mistake on these three fronts and the problem starts setting in. Today we have limited time and I'll only talk about some aspects of it. And the topic is how to stay fit in your busy life. What keeps you busy? What keeps you busy? So stay fit in your busy life is today's topic. What keeps you busy? And the second question, man has always been busy, means you have not become busier today. We have been busy all the time. When you were a kid, you were busy playing. When you went to the college, you were busy preparing for your exams and you were busy doing some other activities. Then you got married. You have other activities to do. Then you started your business. You have more activities to do. So it's all about the change of activities that is taking place. It's not more number of activities that are added on. And the difference that causes so the problem is not the workload. The problem is how you perceive that workload. You take it as stress at times. Now, my understanding, my personal understanding, and I believe that is very correct to quite an extent. Earlier, people had breaks in between. They would do something and then there was a small break. Let's say I had my breakfast. Now I'm going to my fields to plow. Now when I walk from my home to the fields, there is a small break, a small mental break. I'm only driving a cycle there. Then when I'm doing that activity, I'm only doing that activity. I'm only plowing. I'm not doing anything else. Then when I sit down under the tree and I have my meals, I have my meals. Now, the problem which we think in today's world is that is taking up your mental bandwidth is multitasking. When you think you can multitask, but actually you can't. Your brain is not designed to multitask. So what you think as multitasking is, so when I'm walking from my home to the fields and I'm going either by foot or I'm going on a cycle, I can still look at my mobile phone. So I'm doing some multitask. I'm giving instructions to some people at my home to do this, do that, do this, and then I've reached my fields and I do some XYZ activity, and still while doing my activity in the fields, I'm still busy texting some people, and I think that this is multitasking. And then when I sit down for my meals and I look at probably Arnab Goswami on my mobile phone, I think I'm doing multitasking. But actually speaking, multitasking is a myth. And the problem is you have filled up the gaps. The reason of your stress is, what you perceive as stress, is that you have filled up the small gaps you had in between the tasks. You have not left any mental bandwidth free for yourself. And then you, at the end of the day, then you feel that you are mentally exhausted, you are physically exhausted, your day was relatively not very productive. You have filled up those small gaps. And that was the time when your brain used to come down to resting mode, and then it takes up the next task. Now you're continuously on one task or another. The same time, almost the same number of activities, but you have filled in more, you have filled in the gaps, and your brain does not come to rest. And that leads to mental exhaustion, giving less physical energy free for your body to use. Number one. So give breaks. Take a break. Take frequent breaks. Leave your phone and then go for a walk. Walking and listening to some music on the mobile phone is not a good idea. Do one thing at a time. And people think that I'm walking and I'm also talking to my parents in India, and I'm also, I'm utilizing this time well. Sorry, you are not utilizing this time well. You should be doing only one activity at a time. The problem is you have forgotten something that is very, very important, and that is monotasking. You have forgotten what is monotasking. If I'll ask you to sit down, and don't do anything, that is the most challenging task I've ever given. That is something your mind can't even think of, not doing something. How can I not do something? When I'm in the kitchen cooking food, I'm parallelly thinking whether the clothes are ready, is the machine gone off, or what is the time? Oh, my kids' sessions are about to start, the online sessions are about to start. You're continuously multitasking. And so if I ask you to sit down, you actually can't do that. You think relaxing is something that anybody can do, but sorry, you have trained your mind continuously to multitask. And till some time back, it was considered that if you are able to multitask, you are a good worker, you are a good boss, you are a good partner. But the moment I ask you to think of doing one task at a time, the problem sets in. That is something that we can't do. Sorry. And why it is important? There are a lot of scientific reasons we should do it, and we shouldn't. For example, one simple scientific reason is when you're stressed, when you're weeping. Okay, so let's say when you're crying, where do you breathe from? You breathe from your chest or you breathe from your tummy? When you're crying, that means you are on the top of the stress levels, right? We are picking up an extreme level of stress. When you're crying, how do you breathe? The breathing takes place in the chest. That is the most stressful type of breathing. And whenever you are meeting a deadline, check where are you breathing from. You'll be amazed to see that you are breathing from your chest. And now look at the baby in the house. How does a baby breathe? The baby breathes from the tummy when the baby is sleeping. Or even you breathe from your tummy when you're sleeping. So when you're sleeping, you're actually relaxing, unless you're having a nightmare. But when you're sleeping, you are actually breathing from your abdomen. So breathing from abdomen is the most relaxed form of breathing. When you're doing multitasking, your breathing pattern changes. And when you're doing monotasking, your breathing pattern changes. The lower lobes of the lungs have 7 times breathing capacity compared to the upper lobes of the lungs. 7 times breathing capacity is there in the lower lobes of the lungs. But when you are doing shallow breathing, because of your continuous stressful work that you're involved into, you only breathe from your upper chest. And when you go for a yoga session, when you do breathing techniques, when you follow some guided relaxation technique, what do? We make you focus on one part of your body. We make you focus on your breathing. We make you focus on the yoga pose that you're doing. Because you're doing monotasking, so you relax. So yoga is a wonderful exercise to learn monotasking again. Yoga is not supposed to be done like an aerobics class. It is sitting, doing one posture for 2 minutes, for 3 minutes, then going into another posture, if you can hold that posture for that long. So, solution is to learn monotasking. Now, how to do that? We all have forgotten the skill of monotasking. So here are 3 important tips. Let's do this practical right now. Let's take away something useful, something more meaningful that stays with you for your lifetime from this webinar. So the first thing, focus on one fixed object for 3 minutes. We call it tratak. We call it tratak in our yogic terms. So what you have to do is to focus on one fixed object of your choice. Let's do this for 30 seconds because I have very limited time left and there are some other slides that I have to cover. So let's say I'm sitting in a chair. So I'm sitting in a chair, keeping my hand with my thumbs up, and I'm watching my thumb. Simply watching my thumb for 3 minutes is one type of exercise. Now, because we are going to do this collectively here, so I want you to look at this image, the image on the screen. The fellow who has got his eyes covered from both the sides. And now your job is to simply look at this image. Look at the color of his skin. Look at the color of his eyes. Look at the details of this image. Now you will realize that in this image also there are multiple colors. Light green, skin color, blue color, white color. Let us pick up one color. I am picking up white color of his shirt. And out of this white color, now I'm trying to focus on the button of his shirt. The second button, which is hardly visible on the screen, I'm focusing on that one button. I'm only looking at that simple small dot on his shirt. I'm only and only looking at that point. I'm completely focused on this one button. That is what I'm doing. So this is my exercise for 3 minutes. We have done it for 30 seconds for now. The only idea was to tell you how to narrow down your focus and bring it to one small point and then stay focused there for some time. Recommended time is 3 minutes. Now you can pick up better objects. Instead of staring at a screen, you should be staring at a plant. Or if you have nothing to stare at, just simply focus on the thumb and look at the nail in detail and then pick up a point on a nail and focus there. So this is one activity that you should be doing every day. It not just increases your focus, but it also improves your productivity in the day. Even Swami Vivekananda has said, 2 individuals are different only because of the ability to focus. The ability to focus makes 2 individuals different. There are 2 students sitting in the same class, same teacher is teaching the same subject. Still, one student picks up better than the other one. The difference is ability to focus between the 2. So this develops your ability to focus. It will not only help you to relax, but it will also help you to excel in your career. You will be able to take better decisions for your company. You will be able to take better decisions for your home, for your kids, for everyone. The idea is to become focused. So that is the first thing that you should do. Now, when you should be doing this exercise, I strongly recommend this to be done after meals, after lunch in your office time. Second, focus on your breath for 3 minutes or 50 inhalations in the morning. Your body is designed in a way, your brain is designed in a way that it can only do one thing at a time. Now let's do an exercise. All of you, close your eyes. Please close your eyes and do not look at the red colored bus. Do not look at the red bus. Don't look at the red bus. Do not look at the red bus. Red bus should not come in front of your eyes. The red bus is not on the road. Next thing, keep your eyes closed. Do not look at a white bird. Do not look at the white bird. Do not look at a white wall. A wall that is white in color, do not look at that. People are already smiling doing this exercise. All right, you may please open your eyes now. I asked you not to look at the red bus. Did the red bus flash in front of your eyes? It did. For a first few seconds, and then you actively did some effort to remove the image of that red bus. Then I asked you, do not look at the white bird, and you actually saw a white bird first. I asked you, do not look at a white wall, and the white wall came first in front of your eyes. And then some of you could not even remove it. Some of you with additional mental force could actually do it, remove that white wall in front of their eyes. Now, when we say somebody, don't think negative, do you think that fellow will not be thinking negative? When you tell somebody, don't take stress. When you tell somebody, we know COVID is bad, but don't take tension on it. Do you think that is the right statement you are making? What should be your statement? Mind can only think of one thing at a time. Close your eyes again. Close your eyes again. Think of a white angel. Think of a saint doing yoga pose. Think of laughing Buddha. Please open your eyes. You could see all the three images. Simple. It is simple. Your brain follows what you say. So what instruction should be given? Don't look at the red bus. So you mentally struggle to remove that image of the red bus. Or it is better to look at a white angel. It is easier for the mind to imagine what you are asking it to do. So it follows what you say. So number one, mind can only do one thing at a time. Do monotasking and do some exercise that brings your focus to positivity. So first thing in the day, first activity that you will do from tomorrow itself, when you wake up, you will not wake up rushing for the job. Oh, I have to make the breakfast. If you'll do that, that is how your whole day is going to be. You'll be rushing throughout your day. Let's do it a little differently. I only want your 3 minutes in the morning. When you wake up, when you're half asleep, sit against the bed. Only for 50 breaths. Only for 50 breaths. It will be less than 3 minutes, actually speaking. Focus on your breath. This exercise will increase your focus, will increase your productivity in your busy life by at least 30%. And the results will be visible from the very first week of the exercise. Simply focus on the inhalations from your nostrils. Inhale and exhale from the mouth. So let's do this exercise now together. Sit straight, close your eyes, Today is going to be a wonderful day. Breathe in from your nose, breathe out from your mouth. 1, 2, 3, 4. So this is how you should be doing it for 50 breaths. You're already feeling a little relaxed by doing it 3 times. Already the brain waves change their pattern. So, all right. So the third activity is listening to the guided relaxation techniques, which Dr. Mitali was just talking about. So I am sending you a link in the chat box. It's a playlist of 20 audios, 20 guided relaxation audios. It's on YouTube. Some of them are in my voice, some of them are in a female voice, but they are recorded at a level where the brain actually relaxes. So I'm sending you this link right away, and you can download this, download this, or you can listen to this playlist on YouTube and then follow it. And out of these 20 audios, here is the playlist which I've sent to everyone in the chat box. Out of these 20, you will like only 5, actually speaking. You will not like all of them. Some of them are designed for elderly. Some of them are designed for kids. Some of them are designed for housewives. Some of them will suit better to a working man. And so these are different techniques. I have given you all of them. Some of them are in Hindi, but most of them are in English. Whichever you like, pick up 5 of them. Out of 20, pick up 5, and ultimately you will become focused on only 2 of them. You'll be following only 2 of them after a month or so, and those 2 will suit your body the best. It has progressive muscle relaxation technique, which Mitali Das ji just talked about. It also has guided relaxation technique. It also has special counting and breath meditation work. It has 20 different meditation techniques. And the best part, these were designed for busy people. These techniques are designed for busy people like you. So the techniques are 3 minutes long, 4 minutes long, 5 minutes long. That's it. There are a couple of them which are pretty long as 23 minutes, as long as 20 minutes. But you can do those techniques later. Start with the quick techniques, 3 minutes, 4 minutes, 5 minutes technique. And these techniques were designed for busy people who don't have time from their daily schedules. So we recommend them to do this after their lunch again. Like I recommended you to do Tratak after your lunch. Somewhere around that time only, after you have done your lunch in your office, put the plugs in your ear and start listening to this technique. I'm talking about the earplugs. Right? So follow these techniques, and you will find a drastic change from the very first day of your following these techniques. Very first session will give you excellent relaxation. All right. So last quick tip, and then I believe my time is up, and that is relax the crown and the forehead. Experience instant relaxation of the mind and body. Now the stress of the body accumulates at these 2 points. The forehead, the Agya chakra, the chakra of wisdom, and the Sahasrahar chakra, that is the lotus, and the place where the liberation takes place. If the head office is under stress, if the head office of a company is under stress, the whole company is going to be under stress always. If the head office of your body is under stress, the whole body is under stress for sure. So simply focus on the eyebrows area and the scalp and let it relax. Let it relax. So close your eyes once again. Breathe in from your nose, breathe out from your mouth, and while exhaling, Relax your eyebrows. And when you breathe out, I want you to breathe out with a little push. A little push. With every outgoing breath, let your face relax. Let there be no expressions on your face, no expressions, no happiness, no sorrow, no stress, nothing. Just relax your eyebrows, relax your crown. Relax. If you want to tap your Agya chakra to relax it, you can. If you want to relax your crown and you want to do it with a little tapping, it can be helpful in some cases. All right. So a very quick revision of what we have done in today's session. Number one. Oh, just forget it. So I'll quickly take you through these slides once again. You have always been busy. It's all about filling the gaps. So I want you to take small breaks between your two tasks and do one thing at a time. Doing one thing at a time will keep you more focused, more relaxed, more productive, and it will give you more money also because you'll do better in your career. Multitasking is a myth. Forget about it. And only thing that you have to remember is monotasking. This is the way to go. That is why all bosses of the companies, be it the boss of Apple, be it the boss of Microsoft, or be it the boss of HCL, all do meditations. Some form or the other. They always do monotask. And let me just tell you one more thing here. When Steve Jobs came to power in second time in Apple, he discontinued half of the products. He says it is dividing my focus. So we should only focus on limited range of products, and half of the range of Apple products was discontinued because it was taking the focus away. So monotasking, the smaller you focus, the better it is. Laser focus. What to do? Focus on one fixed object for 3 minutes. Focus on your breath for 3 minutes or 50 exhalations in the morning. So a 3 minutes exercise is what I'm all asking you to do. And listen to the guided relaxation techniques. Pick up the one you like from the playlist. All right. Thank you so much for patient listening. And now I hand over this platform to Dr. Nalini Pati, the one who is the Sutradhar of all of this. Thank you so much, everyone. Thank you so much. Over to you, Mumtaz.
Thank you so much, Dr. Deepak, and I thoroughly enjoyed it. And I promise that I will follow all the advices, and hopefully, a lot better will happen to me and to all of us also. Thank you so much.
For sure. Thank you.
Yeah, that was really good. Now I'd like to welcome our last speaker of this event, our own Dr. Nalini Bhai. He's a senior consultant hematologist and oncologist working in Canberra Hospital, Australia, and is also a faculty member in Australian National University. Recently, he has joined as an associate professor in University of Canberra. He has done his fellowship in hematology in Australia and has also taken his training in AIMS, New Delhi, before he moved to Australia in 2005. Apart from his medical presence, he is a very active community member. He's a president of ORIOS, that is the Organization of ORIOS in Australia. He's involved in various community awareness programs, including TV programs for cancer, cardiac health, and all other common medical conditions, and have done several awareness programs on COVID-19 pandemic too. So with that, I would like to welcome Dr. Nalini Bhai to start the session.
Thank you, Mumtaz. Thank you. Samastanku namaskar, namaste, and good evening, good afternoon. Actually, it was a wonderful session. I don't think I need to say anything after listening to such a wonderful techniques and all these tips which he has shared. It was a wonderful session, Dr. Deepak. I really thoroughly enjoyed, and hopefully we all use some of that in our day-to-day life. So my topic, I'll share my screen. Again, thank you to all of you. Actually, at this time, you'd be doing something else, and but spending some time listening to all these health awareness topic, which is wonderful. And but I think this is important as well. So what I was going to do, everybody can see my screen. I'll just have to minimize this. Okay. So that's fine. Everybody can see the screen, yeah? So I was thinking of talking about two things. People might ask why blood pressure, but because blood pressure is one of the important topic and affects a lot of people. And we'll just touch upon very briefly about cardiac health and COVID-19 vaccine, which is very topical. So what are the common aspects? Basically, I'll try to, you can interrupt me. Everybody can hear me okay? Just I need to see is a yes from one person. Mumtaz, can you hear me? Okay, excellent. So high blood pressure, which is called hypertension, is very common. 1 in 3 adults, so common. So that's why I thought probably we should keep a topic, very common topic. And how do we address this? Maybe just do meditation and yoga, what Dr. Deepak mentioned. So that's probably the solution. But I think we need to know a little bit about what is high blood pressure, what are the signs, what we should do. And then the second part, I'll just cover some aspects about COVID-19 vaccine, which is very, very topical. So again, most patients may not have any symptoms. They may have some symptoms, may not have symptoms. And then 1/3 of those people, they have high blood pressure. They don't know why they had the high blood pressure. Looking at only Australia, 4 million people in Australia, they have uncontrolled or untreated hypertension. So common. So 1/6 of the population never had any treatment for high blood pressure, even though they had it. Significant risk factors for heart attack. So basically, if somebody has high blood pressure, that itself is a significant risk factor for heart attack, stroke, kidney problems. And just so that everybody know, heartbeat 60 to 80 times per minute. So there are two aspects of looking at that. One is the upper part, which is called systolic. The lower part is called diastolic. Okay. So normal blood pressure, if anybody remembers, 120/80. So if somebody has a blood pressure, let's say 122, 139. So they are very clear. Once it touches 140/90, it is very clear by all the definition, including WHO definition, somebody has high blood pressure or hypertension. What happens between that 122, 139? So they're very clear. There's just one number. So 140, yes, hypertension. Up to 139, they're saying pre-hypertensive. Similar, the lower part, which is the diastolic part, 80 to 89, again, pre-hypertension range. So somebody has to take some steps in that range. And somebody has to take multiple readings. I will come to that. How do you take the blood pressure and how many times? And there is a terminology which doesn't exist anymore, but called white coat hypertension. So when the patient comes to see a doctor, they'll have high blood pressure. So, but nobody is wearing white coat these days. Instead, we get black coat. So there's no black coat hypertension. So hypertension increases the risk of the heart disease and stroke, and it is very important factor. And this is the one controllable risk factor. So if you could control your blood pressure, your stroke risk is much less. Okay, so this table, again, I don't want to confuse you, but if you could look at very briefly, what is the ideal blood pressure? If it is somebody has a systolic of less than 120 and diastolic less than 80. So if somebody has a blood pressure below 120 or 80, around that mark, it's a good blood pressure. But still we consider it's normal if it is up to 129. They're very clear. So, we can't mingle with that. So if it is just 130, yes, it's high normal. 129 up to 129, normal. Similarly, there are grades, grade 1, grade 2, grade 3. So depending on what is your blood pressure. So in general, anybody has a blood pressure above 140/90, it is considered hypertension. But it is mild category if it is between 140 to 159 systolic part, and diastolic similarly 90 to 99. So what these numbers mean, as I mentioned in the previous slides, 120/80, let's say. 120 the upper part, which is the systolic, how much your heart is pumping. Similar, the lower part, the diastolic, how much of the heart is relaxing in between two heartbeats. Heart need to relax also. So if there is lack of relaxation, or there is more pressure in the blood vessels, that will raise your diastolic blood pressure. So these two numbers are very, very important. And then as you can see the next line, the last but two lines, 120 to 80, 122 by 80 to 140 by 90, that is the normal range. Still it is considered, but you need to take some steps just so that it doesn't cross above 142, 140 by 90. So how do you check your blood pressure? So make sure the person is either seated or lying down, but should be in a relaxed mood or relaxed, everything, like should not be talking and all that. So measure on one arm and without any thick clothing. So if there is a thick clothing, you should remove it. Ideally, it should be the above. So when you bend the arm, it should be above. So it shouldn't be sitting in the middle. Then it will give a wrong reading. So it should be above. So ideally, it should be middle third of the arm. So make sure that you wrap properly and position the center of the cuff above, as I said. Movement. So there should not be excessive talking, or patient shouldn't be moving. It should be a calm and quiet state, and maybe sitting or lying down, and should avoid taking a coffee or smoking and strenuous exercise. So then blood pressure will change. So if the first blood pressure is high, what you should do, maybe take a second one after 5 to 10 minutes and then compare. If something like you're not sure, then take 3 readings and take an average. So just very briefly, any blood pressure above 180 by 100, it is very important the patient should take immediate action. So again, whatever I'm saying here, it's like just for general advice purposes, nothing specific. If you have a confusion, you should talk to your doctor or talk to me separately. But again, this is for general information only. So any blood pressure above 160 by 100, they should also take action, see the doctor. May not be immediately to go to emergency, but should see the doctor maybe next day. But any blood pressure between 140 by 90 to 160 by 100, they should be discussing the doctor in the next appointment. So they can wait a little bit, but still ideally should see the doctor as soon as possible. What you should do, basically, as we know, sodium or salt that holds excessive fluid in the body, okay? And that leads to heart to work much harder. Same thing, potassium, which burns most of the salt, and then that also contributes to the high blood pressure. So what are the common misconceptions? So a lot of things people we talk about, we don't know, or maybe we have some confusion. So people think all the symptoms like, nervousness or sweating and difficulty in sleeping is all linked to high blood pressure. Not necessarily always. If you have those symptoms, it could be something else, could be something more serious. So you need to dissociate these two things. Most patients may not have any symptoms. They may have some headaches or may have some uneasy feeling. But if somebody has nervousness or sweating or difficulty, it could be different. So then the other thing is high cholesterol, not always lead or not, same thing as high blood pressure. So everyone, again, when has blood pressure, I should not be worried. That's again a myth. We should not be carried away with that. And then the other thing is women don't have to worry about high blood pressure. That's also not true. So how do we control blood pressure? Again, reduce our fat intake. So particularly the saturated fat, stop smoking. Again, I don't think it's not very common fortunately in our community, but again, it can be the problem. Cut back on alcohol, be active, may need medication sometimes if the blood pressure is above certain limit, maybe, those numbers I told you before. And obviously, as Deepak ji mentioned before and Dr. Mitali mentioned before, so again, stress management by different things will be very useful. Now, this slide is very, very, very important. All right. This is some of the warning signs which could be sign of heart attack. Like we used to know before, like somebody has the pain on the left side of the chest or going to the jaw and all those things. It may not happen always. So I would like to give you some tips, some of the symptoms or signs which could be sign of. This has nothing to do with blood pressure. I just changed the term, just so one slide so that people are aware what could be the warning signs, but still somebody may have a silent heart attack. So cold sweats, like not necessarily heavy sweating, but could be mild sweating unnecessarily. I'm feeling a little bit dizzy. And if you look at the pain in gastric symptoms, like somebody has like feeling like dyspepsia or indigestion or something like that, that could be a symptom. If it is a recurring problem, that could be a sign of heart attack. Not feeling well, feeling nauseous, like vomiting feeling all the time, that could be a sign of heart attack, and shortness of breath, which is if it is unnecessary. But there are other symptoms as well. So I will change the topic. I mean, that's what I wanted to say very quick because we don't have much time. So this is very topical, COVID-19 vaccination, and then a lot of issues, a lot of controversies, and we are hearing from the media about the clotting risks and all that. So I thought I'll clarify some of the things, and then that probably will be useful for all of us. So this is what is happening now in India. Like the numbers have gone kind of skyrocketed over last just 2 weeks. Nothing was there. Like if you look at the previous numbers, and that was not that exponential way, but what is happening now. And then the daily number of cases, if you see, that was the peak around that time, July, August. I have felt a bit of that when I was there in India around August. But now look at the numbers are going quite significantly high numbers. And again, deaths also increasing quite rapidly. So as we always know, prevention always better than treatment. And we know at this point, there is no specific treatment for COVID-19. No matter how many papers we read or how many media things we read, all these antibiotics they use, everything, but there is no definitive treatment that has been tried and proven. So that's very clear. Now, what measures we have? Very basic, which was existing. Somebody shared a black and white picture that was 100 years ago when the swine flu happened. And we exactly do the same thing now after 100 years. So social distancing and mandatory mask, which is again, people in India, I mean, I just stress this point over and over again. If you want to be really protective of this thing, I think the only option is put N95 mask, because surgical mask, again, a lot of controversy. I don't think that if you don't have it, then that's different, but it has to be a 95 mask on top, possibly put a surgical mask on top. And then while talking, that's what commonly happens in India. They pull the mask and while talking. So by that time, what they do, they transmit and they get the infection as well. So don't touch ever. Once you put the mask, that has to stay there as tight as possible. And it should be breathing through the mask, not from the surrounding area. That's very important. If it is not tightly fit, then you are not protected. And then once you touch, because there will be a layer of the virus on the top. And then if you're touching it, then you're trying to do something else, then you will transmit that. Because there will be layer. That's what the whole purpose is, to filter the virus. Hand hygiene, again, I don't want to stress, but vaccination we'll talk about, and avoid gatherings. And what are the problems that is happening now? Because it's all what we talked about at the beginning of the pandemic, flattening the curve. When that doesn't happen, the number of cases go quite high, then that overburdens the health system. Again, we know the health system in India is actually, again, family driven, or somebody's driving the whole thing, not the system itself. That becomes, again, more overburdened. And this is a mutational virus. Again, it transmits pretty fast, and that is a major concern. And people are talking about there are already 3 or 4 mutations, and they transmit fast, and nobody's 100% sure how the vaccine is going to work. But again, coming back to vaccines, this is a very basic concept of how the vaccines work. So no matter what type of vaccine you use, ultimately it is either what it does, you take a protein of the virus and inject to the person, and then the person will produce the antibodies. So that what happens, basically your body's different white cells, they sense that, they produce the antibodies, and those antibodies then recognize, yes, there is something may happen, so they get prepared. So down the track, if there is a subsequent infection happens, they fight, and that's how they clear. And in case of mRNA, so that in case of a vector virus, which is AstraZeneca vaccine for us, and Covaxil, I think in India. So what they do, same thing. So they inject to the virus, another virus called adenovirus. That virus infects the person. Again, that's not an infective virus. So basically, that is deactivated virus, but they'll enter the cell and tell the cells, okay, hey, just produce the antibodies. Those antibodies subsequently will protect the person when subsequent infection happens. During this time, again, as we know, the sequencing was done very quickly in around February, March. I think one of the lab in Melbourne, they found the actual genomic sequence of that virus, and they started preparing the vaccine very quickly in May. So we know any drug in a virus, any vaccine takes roughly 8 years for the production, but this happened within 8 or 9 months, so fast. And then just to highlight the two ones which we have here, which is AstraZeneca vaccine, which is a viral vector vaccine, we all know, so I don't want to spend much time, but usually this is a harmless virus, but it will produce, it will enter into the cells and they'll replicate, and they produce antibodies, trigger the antibody production. In a way, they protect against subsequent infections. Similar, the other one, Pfizer vaccine, that is a RNA vaccine, is not a cellular structure. So they extract the mRNA sequence, and that mRNA sequence is actually injected to the body, which recognizes this is a foreign, and they produce the antibodies, which is immune response. And then, so both of them, they do similar sort of thing, but different way. One is a cellular structure, the other one is just mRNA, which is the extract of the cell. And then this is a bit important. We all asked about, there must be something wrong. How come they prepared the viral vaccine so quickly? So what they did, so usually when there's a clinical trial that happens, phase 1, phase 2, like that takes 8 years or 10 years. What they have done, they knew there was going to be a problem like this. We need to have the vaccine fairly quickly. So instead of the traditional timeline, which is the bottom part, they ran the whole thing concurrently. So basically simultaneously, they run 2 clinical phase 1, phase 2, phase 3 trial at the same time. And then when they realized there is no major toxicity, they went for, they sent for production. So production started much earlier, even they had the final result, but they've proven to be effective. So going back to India's, the vaccine that we have, there are 2 vaccines, Covishield, which is being used, and Covaxin. So, and doses you can see there. 1st of January 2021, Covishield has been launched and started on 16th of January. And Covaxin, they have ordered 10 million doses, and again around the same time as Covishield, they have launched around the same time. Sputnik, I think, is coming, maybe launched, I'm not sure, but I think meant to be launched in April. So the fact remains that we always think about mRNA vaccines may affect our DNA system because they're entering the cells, but it doesn't. This is just a vaccine. It doesn't affect our DNA structure as a whole. And also it doesn't enter the cellular structure like nucleus. So long term, there's not been any major damage. Again, a lot of things are not known, but what we know so far is not going to cause any major changes to the cellular structure. And the vaccine cannot give COVID, right? So again, probably I'll just keep this one. There are a couple of things. So important one, actually, the long-lasting immunity. Again, nobody knows. There could be a need for boosters. So now people are thinking maybe people would need boosters once a year, every 12 months. But I think what it does, one important thing, it reduces the death. So if somebody has second infection, maybe it doesn't protect against completely. So we know the efficacy is roughly 65 to 92 or 93%. So depending. So there are a lot of literatures in favor and against both AstraZeneca and the Pfizer vaccine. But again, overall the response rate is around 65 to, on an average, I would say 70% response rate. There could be a second infection, that is possible. But what it does, it prevents death and serious complications. But still there are cases where people have had all the vaccines, they have died. But probably if you look at the overall picture, maybe some protection. So what are the safety concerns? What are the issues? Basically, that's what in any literature you go through, it's a no significant safety concerns were identified in the clinical trials. But there are issues that happen, which is most common, redness and the swelling at the spot where they take the injection, which is very common. Then next to that, tiredness. And fever is not that common, but people have fever. Myself, I have fever. Chills, again, around 30% of the cases. Headache is very common. Almost half of the patient will get headache, muscle pain, and joint pain. But importantly, all the symptoms should improve within 3 to 4 days. If the symptom persists after 7 days, and the recommendation that you should go and see your GP. And the symptoms should be mild to moderate. You may have to take some paracetamol or Panadol, which should be good enough. It is advised that you should not take any strong painkillers, just Panadol, but because the safety on the liver, again, not studied when you had already vaccine. and that might have because there's a virus is affecting you, so this is an attenuated virus, and if you take more painkillers, that may affect. So, and symptom general, as I said before, less than 1 week. But one significant contraindication, if somebody had any reaction to any vaccine, can't have, so we call anaphylaxis. That's the only contraindication for taking vaccine. So clotting, again, what is called vaccine induced, so low platelet count called thrombocytopenia, sorry, long word, and thrombosis, so clotting. So VITS, that's a new syndrome which happens, and what we are listening from the different media sources, but this is very, very rare. If you look at a lot of literatures, the incidence is 1 in 200, some of the literature say 1 in 100. So nothing, nothing that you should be avoiding the vaccine, and very manageable. And benefits, again, it reduces the transmission. So one-to-one transmission also will be reduced. It protects you from the serious illness, potentially reduces the risk to patients, peers, friends, and families. And it obviously builds the defense against COVID-19 in this facility as a team effort. So that has to be given. And getting, again, vaccine puts an added layer of protection. Okay, but you need to continue what you're doing. But this is an additional benefit. And again, it will protect you from mild to severe. So basically, you may have mild, but may not have severe infection. Protection, as I mentioned. Who should be vaccinated? I think in Australia, everybody would be vaccinated ultimately, all above 18 years. But first and foremost, all the frontline workers, including the health workers, social care workers, as well as the and then hotel quarantine workers, priority groups. Anybody has any sort of problems like chronic illness, like diabetes, cardiac problems, lung problems, liver problems, kidney problems, they should be getting the vaccine. I think you speak to the doctors, if anybody has, or you know somebody has these problems, they should have the vaccine very quickly. And I mean, should have already have the vaccine already in Australia, in India as well. And patients with cancers, chronic health conditions, and patients that are getting some drugs which will suppress their immunity, they should be getting vaccines quickly. And anybody had a transplant as well. So pregnancy, again, the recommendation at this point is that if somebody is exposed or going to be exposed to high risk COVID risk infection, then they should get it. Otherwise, if you are not exposed to or going to be exposed to COVID risk areas, then they can avoid. But if somebody has it, the recommendation, again, they can delay the pregnancy, but if they're already pregnant, they don't need to do anything. So there is no major safety concern, but it is not known. So that's what the recommendation is. If somebody by mistake had the vaccine and they're pregnant, that's fine. Just continue with the pregnancy. And breastfeeding is absolutely fine. So after the vaccine, what we should do? So basically, doctor, nurse should observe them for 15 minutes. And again, one should follow, particularly at this point, what is happening in India. Everybody should continue to use the mask. I would say N95 mask, hygiene, avoid gathering, physical distance, all those things. We need to continue to do that. And we know that vaccine is not 100%, doesn't give 100% protection, but it will reduce the spread. So that'll try to help flatten the curve, which is very important. And hopefully people will recover first, and we don't have to do lockdowns probably down the track. So clotting risk, again, this is my last but one slide. So we hear a lot of things, particularly from media. So the incidents. So what happened when the clotting risk actually were published mostly in the medias in UK and here, that before then they never seen or thought this is going to be risk. So then they went back. So particularly in UK, they have vaccinated almost close to 35-40 million people population. So they went back. So what they found, out of 17 million, almost 20 million, they had only almost 144 cases. And Germany, they had around 50 cases. Norway, they had 5 cases. With Johnson & Johnson, 6. But there's a none in Pfizer, but that's not true. And there are case reports where they have patients, they had Pfizer, they had the clot as well. So what is this problem? So basically, all the cases that has been reported so far, around 90% of cases are females, and they are less than 50 years of age. You must be thinking why Pfizer is given to below 50 years and AstraZeneca above 50, what the more than 50 years people have done wrong. So nothing. The incidence of clot has been seen people they had AstraZeneca vaccine, mostly younger than 50 years, and they're females. That's why I strongly recommend females not to have AstraZeneca, particularly if they're below 50 years of age. Obviously, in Australia, it will be Pfizer. But there are some signs. They're very typical. First thing is very rare. Second, there are clear signs to detect this condition. It's not a common condition. And also we have a drug like heparin or Clexane, you might have heard, we use always. And people get clots while using the blood thinner. Similar sort of thing happen here. So the mechanism totally different. And they have got like one of the blood tests called D-dimer, clotting, and low platelet. So this is not a difficult to diagnose, and there is a plan in place in Australia. So to manage, even in India, I was giving a talk the other day about the government of India kind of group, and then I mean that's what we are saying. The different strategies how to manage. So basically, early testing. If somebody is suspected to have clot or a headache, mostly the headache is the important thing. One should go and see the GP and should have a scan. And there is no correlation with if somebody had previous conditions, and there is a treatment that is existent here. One we avoid is the platelet count. So platelet count will be low. So we teach all the junior doctors never to prescribe any platelets if somebody is presenting with headache or something, or there is a clot, platelet count is low, but had a history of vaccination. So don't give platelets because that'll aggravate and that might kill the patient. And you give immunoglobulin. So there are strategies, and it's not common, and I think still is highly recommended to go with the vaccination. So sorry, might have taken a bit more time, but there is hopefully will be light at some point. I will see the sunlight. Thank you, thanks a lot, and hopefully people get the vaccination in India. And here obviously we are a little bit slow. Everybody hopefully will stay safe. It's a difficult time, but I think, I mean, we can't stress enough that we have to still do it, and we have to get through this, and one day it'll be a wonderful world. And thank you from all of us from Warriors community. And I will stop here and see whether there are any questions. And before that, I would request Mamtaz, I think I'll just screen sharing.
Thanks a lot, Bhai. That was really informative. I'll hand over to Ram now for
just 1 minute. I think Kishore Vaina is there. He's a very senior journalist. I'll hear just the situation there in Odisha. Kishore Vaina, just 1 minute.
Namaskar. Namaskar. I was listening. Thank you very much. You wanted me? You wanted something?
Yes, just a few words. I mean, whatever, how the situation there, and
I joined it a little bit late, maybe 15-20 minutes late, but it was completely. I was an interesting and engrossing session. I was not knowing. I didn't have the clue what is going to happen.
I'll just introduce Kishore Dwivedi. He's a very senior journalist and has been with multiple organizations, leading a lot of organizations. He's a chairman of World ODI Society. So he's doing a good job there, and looking forward to listening to words.
I said it's a fantastic and engrossing session. It was mind-blowing, and maybe it's elevating for me because not like this kind of sessions one used to interact very often, and maybe I listened to Madam and then Deepak ji and you completely, because at this gloomy and pessimistic scenarios, you are all saving graces. And the small bit things Deepak ji said about stress-free, to live the stress-free life, and that was eye-opening for me. And then the thing you explained, the thing is you said took longer time. No, absolutely not. In a very brief, neat, crisp way, you put the matter straight, and that's great. And you were asking about India or Odisha. We have been listening. You have been knowing the kind of thing. We have been listening every day something devastating thing, every day bad news, and from every side negativity is coming, and your session, I think, definitely will help us to coming out of all these things. And the beautiful thing you have shown that there is a light end of the tunnel. Definitely, we are all hoping that not that good which you are passing through, which you have already explained. And in your thing, you have explained about that small bit of things about blood pressure and other this kind of things that normally in the leading of life, a normal life, we used to ignore all these things, do not know much about it. Only thing when problem arises, when grave things does, then we go to a doctor and does it. But it's better if we get counseling like that before that, so that we take preventive measures and do not have to go to doctor. Things do not go pass out of the hands. So it's fantastic. Thanks a lot for enlightening us these kind of things. So thank you very much. And it's my fortune to take part of it. Thank you.
Thank you. Thank you, Vaina. Thank you.
Thank you, Vaina.
I think there are questions. Are there questions? And I think Prabhati.
Yeah, I'll pass on to Dr. Ram for a formal vote of thanks and also question answers.
Thank you, Mumtaz Di. As Kishore Bhai just mentioned, it is literally an utter pleasure for me to attend such an informative session. It is informative. There are simple methods and all the guidance are strategic, which we can use on a day-to-day life easily. Any person can do it. And that is really good for our health and well-being. Thank you so very much for such informative sessions. I would like to start with Dr. Mitali Das, and thank you Di, for sharing your expertise in mental well-being in such a defined and strategic way. The way you have talked about anxiety, how to detect stress, how to know when you are having that, how to handle the stress, and all the methods that you have mentioned. Literally, those are some things which each and every person who are around the world need at this hour. Thank you so very much for your guidance and sharing your expertise in such a beautiful way. I will also like to thank Dr. Deepak Sachdeva. I have attended his sessions the last year, and I will say he has not changed even a bit. All his methods have always been practical and useful. These are always practical and always useful. No matter what he does, it will be such simple and to the point methods which we all can use for our well-being. Thank you, Dr. Deepak, for sharing such informations. And last, Dr. Nalini Pati. Bhai, you have done such an amazing job by organizing this webinar. Thank you so very much for organizing this and bringing in Dr. Mitali Das as well as Dr. Deepak to give us such a kind of information. Thank you. And also the information that you have shared in regards to COVID and also our well-being, our health, such kind of parameters. We keep on getting quite a lot of informations, but the information that you are giving, those are like specific, which will be useful to all of us. At this point, I would request Dr. Mitali Das, Dr. Deepak, and to Dr. Nalini also to share these presentations with us so that it can be shared across and it can be beneficial to everyone. Last but not the least, I would like to thank the whole Oreos team for organizing this session and Mumtaz Di for being such a wonderful MC and handle this whole session with such expertise and smoothness. Thank you. Now I would like to go ahead for, I think Dr. Prabhati is having some questions. On to you, if you can please come up with your question.
Yeah, thank you, Ram. And I must say thank you to all the organizer and the speakers. I won't go to the theory that was discussed here, but I just want something practical that we are facing here, because when we are dealing, we all have relatives back there, and with the digital forum, we are very much overloaded with the digital forum here. When we see the graph, literally my BP also increased all of a sudden. So that is where I would say that from the last talk that is about the vaccine and all this, I can take a few dot points what we should consider is definitely we should take the vaccine. That is what I got the point. And the parameter that are related to the blood clot, that is under research, but it is low. So here the GP or the concerned physician will be the person to guide you. But what in common people in the social forum we found is the confusion, the fear. And when we are listening to the news that somebody died, a friend's relative dies, our relative died. So the grief, the overall mass grief we are leading here, being in a very far away location. So that is common to all of us. And the other question, I must appreciate Deepakji and Mitali because that is such a very important topic, mental health. I do work a lot with the community mental health, and I've seen the practical situation, what we say. And Deepakji, I just appreciate that you said, say when you are using your language, change to a positive. And that example is such a fantastic example. And that is applicable to us when you're talking to another adult in community, or even when you are dealing with children, like don't do that means they are going to do that. So it's very important practical tips. We, as an adult, even when we are dealing with the community members, we are texting them, we are talking to them, we must be mindful of our language, because little bit shift of that language makes a huge difference in conflict management, in dealing people's different problems. So thank you for that. And Mitali Yapa, I have a lot of things to ask you in terms of social mental health forum. So I will ask a couple of questions here. In practically, I'm a doctor, but I've seen that lots of stigma among doctors, among our community people. You have a huge fear about when you're talking about mental health. We can give lectures about mental health, but when in real situation we come, we don't talk, we don't go. And we are ashamed to talk about it. We are fearful that somebody will notify it, somebody will isolate us. Like we are in a good position, we should not talk about it, we should not cry, we are strong. So there are lots of confusion about mental health, even in this situation. Even in this situation, we don't go to the professional in a grief in this situation. So not every community member is expert in how to deal with those kind of situations. So what will be your tip when we are dealing with this health situation that is socio and biopsychological situation? It is not completely physical, it is more of social, more of psychological, more of complicated. So what will be your tips to our community member here? How they should deal with grief and when they should go to the professional or to some expert?
Well, thank you for raising that, Prabhati. I think my light is a bit low, but let me address you. It's a very important thing you talked about. Stigma is definitely there, and that will take some time to go.
Yeah.
But with doctors and I have been seeing a lot of doctors, particularly interns and surgeons, and in any specialty, they do come when they require help, and they are well aware of the confidentiality of their sessions that they have with a psychiatrist, and that will not be divulged to anyone unless there is a risk to their patients or to themselves. And we tell that at the first instance that their seeking help is a private matter for them, and it's very confidential. So it is not going to affect their AFRA or their registration or their function unless there is a risk. And that applies to everyone. Every individual who comes to a psychiatrist, there are confidentiality matters that are discussed in the first place. And apart from that, I think it is good to educate the common people in seeking psychiatric help is just like anyone seeking help for their blood pressure or for their diabetes.
Yeah.
You need treatment, and that's it. it is not something that you have brought on in yourself, or it is any kind of weakness on your part.
Absolutely, absolutely. So yeah, so for our community members who are attending here, sometimes they're confused, like what is anxiety? Like sometimes the anxiety can manifest as a fear or as a anger or something different. So just for a common people, if you could explain the anxiety, like in current situation, in COVID pandemic situation, how
as
it
I
can
mentioned
manifest.
in my talk, anxiety is worries are definitely inevitable in this sort of a situation. But what becomes problematic is when that anxiety is affecting your day-to-day routine. You're not able to function at your work. You cannot concentrate on your work because what is happening, we cannot change. We can only change or modulate our response to it so that we are able to handle it better.
Yeah.
Sometimes we do feel helpless, but given the circumstances, what can we do in that situation?
Yeah.
So seeking help, talking to friends, finding solutions. If you're not able to do that, then you need some psychologist to help you with, treating you with the breathing techniques, with relaxation techniques. And if beyond that it is not helping, then do see a psychiatrist or a GP for some short-term anti-anxiety medication.
Absolutely, yeah. And just sorry, because I'm asking this question because I think these are all will be useful for all the attendants here. So in this grief, like they're going through the mass grief now. So whenever we're talking about somebody's death and something. So how they will process their thinking, so that will help them to relieve a little bit of stress.
You mean grief? Grief is a very natural process and that should not be stopped.
Yeah.
There is a natural grieving process for everyone.
Yeah.
And that takes up, grief itself, in the normal grief of bereavement, takes up to 6 months.
Yeah, so let it go the way it is
go.
coming. Yeah, absolutely.
Yeah, and this time, in this sort of situation, it may even take longer because we are not able to see our loved ones that we lose, and we are not with the family in the grieving process. So that tends to linger for a period of time until a closure will come when you are with your family and able to grieve with them.
That's good. Thank you.
Yeah. We can discuss more of this at a later time. I think we are running out of time today, Prabhat.
Yeah.
Yes.
I'm happy to take this any more time. You can.
Yes, thank you, Nani. Prabhat, now I think Sarthak Mohanty is having some questions. Sarthak, on to you. You can bring up your question.
Yeah, thank you all for the informative talks. It is really interesting. So my question is for the Mithali ma'am. Like some people told that if you have anxiety or stress, you eat chocolate, it will go. So I am following this is last 2 years or 3 years. The one thing I am gaining only weight.
So that's a good question. I did talk about modulating your appetite and your eating habits and drinking habits. In the short term, the chocolate might help in giving you some gratification. But obviously, all the side effects are there. So maybe moderation is the way to go. Sarthak, one bit of a chocolate a day might be enough.
Okay, I'm like eating 3-4.
The best solution is not to buy and keep at home.
Okay, yeah, that's good. And we had a lot of tips from Deepak ji.
Can I add something to this, please?
Yeah.
Please.
Let's go to the root, Sarthak. Why do you feel that? So there is only one thing your mind can actually hold on to. It can hold on to stress or it can hold on to happiness at that particular time. So whenever you are feeling low, stressed, anxiety is overpowering you, go and watch Tom and Jerry.
Yeah, generally I do that.
Go and watch, yes. So instead of a chocolate, go and listen to Kapil Sharma or stand-up comedy shows. Your mind can only be doing one thing at a time. You can't do two things at a time. So if it can only do one thing, you choose that thing. And your intake of chocolate will considerably reduce. I'm not saying it will go away 100%. It's a practice that you have to develop. So start focusing on your breathing at that time. Start focusing on Tratak at that time. Focus on something that is more healthier. Mind can hold on to one thought at a time, only one thought at a time. You can't hold on to two thoughts at a time. So do something of that sort. Get on to some laughter shows.
I have got one question, Deepak sir. There are so many negative news going on around. How to manage those negative news, like negative message, negative WhatsApp, all these negative things going around? How to manage every day in WhatsApp? All this news channel is giving all the negative messages. How to manage this? This is Tapas. Thank you, sir.
What you should be doing, Tapasji? What you should be doing? What do you want? What you
how
don't
to manage
want, what you don't want, what you don't want, what you don't want is like, I don't want to see the red bus, I don't want to see the red bus, I don't want to see the red bus. What do you want? Define that. What do you want?
I want to know all the positive news. How to get rid of this, all this negative emotion, negative
Getting
news.
rid of is you can't get rid of it. You have to hold on to something else. Only then you'll get rid of it. So
Okay.
see the solution. I'm asking you, what do you want? And it is taking you time to give me the answer. What do you want is happiness. What do you want is easy news. What do you want is relaxed news. You want to know the facts, what is going on around in the world for sure, but you don't want an overdose of of that information. So what do you want? You have to define what do you want, and then you can actually find news channels which are giving only limited information that is negative, and there are news channels which are giving you the right amount of information. Like I particularly watch Beyond. They give limited information about what is happening all across the country. They are giving you information all across the world. And then you switch to another channel, which is not a news channel actually, but you can switch to a different news channel, to a laughter challenge, to a different channel that is only talking about the history of the mankind, probably something like National Geographic. So what do you want? You have to define what do you want, and then go after it. At the moment you're saying, no, I don't want this. What do you want? You have to define what is needed.
Okay. Because I have to just change my way of thinking, a way of seeing, different. Okay.
So what you want is what you have to decide. What you don't want, what you want is what you have to decide. And then go. That's simple. I didn't want to listen to Arnab Goswami every night. I was fed up of that type of information. I didn't want to listen to other news channels also which are probably biased. I wanted something else. So I was looking for it, and I reached to a couple of news channels. So they're serving the purpose. So I knew what I want. So you have to decide what you want, and you go after it. You'll have it. So simple. You have to wish for it, and it is granted. It is as simple as that. Sorry. Thank you.
Thank you, Tapas Bhai, for such a amazing question.
UK, he's here. Do you want to say a few words? Just few words, Prakash.
Hello, thank you, Nalini. It was nice that I could actually bump into your program. It was lovely to hear all the psychological support and the moral aspect you are providing. We all need that at this moment of time. I would be very obviously not overloading with any information. At this moment of time, I would say, as a professional person, I have been helped or guided, or you can say supported by my employer. So that is by far one of the best support I have received from the employer, that they are doing regular sessions for us and we can access it as and when needed. So I'm not sure whether you have got that support over there, but certainly worth exploring within your community. And as a community, we have been just holding hand together. So whether it is praying together, or whether it is online session, or even just sort of saying, I am available if you need a support for funeral, if you need a support for bereavement, let's go together. I don't know the solution, but let's do it together. So that's what I have been doing for last 1 year. And to my surprise, I have met so many people which I would not have met before, but we crossed the bridge as a group. So again, having a neat, close community like you have in Australia is very, very helpful. So those are the sort of tips I would like to give. But thank you, Nalini, for inviting. And we must do things together more and more.
Okay, thanks, Prakash. Thank you. Over to you, Ram.
Thank you. I think we do not have any other questions or concerns, so we will call it a.
Yeah, I have a question for Dr. Deepak. You said that we'll breathe in by nose and breathe out by mouth. Why mouth?
So you don't have to filter the air when it is going out. You have to filter it when it goes in. Number one. Number two, when you breathe in from your nose, there are certain receptors there which help in vasodilation. So the arteries, the vessels can dilate. When you are exhaling that air, you don't want those particles to go out of your body. So exhalation from the mouth is the second reason for that. Third reason for that is when you exhale from the mouth, you actually release the pressure. It's easier, it's relaxing, it lets go. So we always prefer breathing in from your nose and breathing out from the mouth when we are doing the relaxation techniques. When you're walking on the road and you want to breathe in from your nose and breathe out from your nose only, that's okay. That's acceptable. But if you can breathe in from your nose and breathe out from your mouth, that's medically recommended for achieving lower levels of the brain. So it relaxes more deeply. So whenever you are doing a yoga practice or meditation practice or breathing practice, then it is breathe in from the nose and breathe out from the mouth.
Thank you. Thank you. That was good to hear.
Thank you.
Start practicing that.
Please.
Namaskar. Namaste, Deepak ji. Sorry, I couldn't join earlier. I just wanted to see you all. It's good to see at least.
Same here.
Thank you very much.
Okay, I think we are already towards the end of the session. Thank you all for attending. And if you have any questions or queries, feel free to contact us, the Oreos team, or Dr. Nalini as well. And we will be sharing the presentation from our Dr. Mitali, Dr. Deepak, and Dr. Nalini. We will be sharing it, whoever requires it for their information. Thank you so very much for attending. And
thank you all. Bye-bye.
Thank you all.
Thank you, Deepak ji. Namaste. Thank you.
Namaste, Deepak ji. Thank you.
Namaste. Thank you so much for having me.
Thank you.
Thank you.